we are now crossing to a level of emergency, and that emergency requires each of us to determine what can we do on our own, voluntarily, freedom though it be, before we have to take government action on behalf of the whole of society. I would prefer that this moment be a moment where every individual, every business, every not-for-profit organization, every community organization now looks and says, okay, we understand that COVID numbers are rising again in Westchester County. What are we doing? How are we doing it? What can we do voluntarily? How do we, on ourselves, make sure that mask usage is more widespread to stop the conveyance from me to somebody or somebody to me? What can we do to ensure that our workforce or the people that we deal with every day are vaccinated? Now that we have boosters out there, those of us, and I'm one of them, that are double vaxxed, don't consider yourself properly vaxxed until you get the booster shot. I believe I'm getting mine this week at some point in time, and now it's open and eligible to everybody. You can get a local pharmacy. You can get it through one of our mechanisms. Ken in a second is going to talk a little bit about the satellite locations that we have coming up. But this is the moment in time in which each institution will start to look at how they operate and how they have to adjust to circumstances and numbers that are rising.
We've been through a lot. I think we're going on 22 months of managing this, and the good news is that we've learned a lot. The bad news is it's not over. The good news is we've learned a lot, and to be able to provide those lessons is really important. And I think a lot about what you spoke about this today is really making sure that we're not doing too little, but we're not doing too much, and we get it right, and we understand and we act from the facts and our experience and what the issues are of today. And so when we heard about the new executive orders, I think we're all in a good place in that we want to be cautious, we want to learn, we want to be prepared, but at the same time we don't want to overdo it. And if we remember, hospitals were asked in the beginning of the pandemic to stop elective surgery, to make room for patients in the hospital. When we think back on the last 22 months, that volume, that need for hospital capacity for us here locally was really about 6 to 8 weeks. We know that the pandemic started in March, and by May, our numbers were really coming down, and we were able to reinstitute elective surgery. And so when we talk about that being one of the triggers, as a hospital leader, we have a lot of things to balance. Yes, we want to be prepared for what might happen, but at the same time, we don't want to go backwards. And we know that during that time, a lot of people didn't get services that they needed. They put off their health care. And so we're very sensitive to that.